Good morning. My name is Tola Ajayi from Nordica Fertility Center, Lagos, and you are welcome to the Reproductive Health segment of Today on STV. And I'm talking to us this morning on age and infertility. The late childbearing is becoming increasingly common in our society for several reasons. Financial security is one of them, both from male and female. Unfortunately, people would think until I'm made, until I have what it takes to be a man or a woman, that's when I'll be ready to get married. And women's liberation has brought many advantages, but late marriages is definitely not one of them. And women must be careful, because if you think you get married and you want to have children when you want it, it may not necessarily be so. Because if you think you have been fertile in the past, probably you've been pregnant in the past, and you think that when you get married, then it's easy for you to become pregnant. It may not be so. And it's a known fact. The fertility decline with increasing age. Educating people about fertility decline with aging is very, very poor. People don't get to know about the impact of age until maybe when it's already too late. And that's when they begin to run helter-skelter looking for a solution where there is none sometimes. And aging of the ovary is the most prominent factor. In a woman at puberty, there are over 300,000 eggs in the ovaries. And for each egg that matures and is released during the menstrual cycle, that is during ovulation, at least 500 others, that is eggs, do not mature and are absorbed by the body. And as the woman ages, the remaining eggs in their ovaries also age, making them less capable of fertilization and their embryos less capable of implantation. The real issue is egg quantity and quality, which translates to embryo quality after fertilization. That is not to say that a woman cannot get pregnant even at 50 on her own, but it's very, very rare. And so, women should take note. As you advance in age, the chances of becoming pregnant also decreases. And we do our best to overcome advancing age with fertility treatments such as IVF. However, egg quality is a significant limiting factor, because even in IVF, we are still depending on quality egg. And if you do not have one, then it's difficult for you to achieve pregnancy, even with IVF. And it is not out of place for a woman that is 37 or more to do a fertility check, even if she's not married. So if you know you are 37 and you are not married, see your doctor. Let them run some tests for you. So if there's a problem, it can easily be picked out. Because sometimes, even before a woman reaches age 37 or so, she has already reached menopause. And it's always better to know what you are dealing with even before you get married. The ovarian reserve test, the test that we do between day 2 and day 5 of the menstrual cycle, is to predict the remaining egg supply and the ability of the ovaries to respond to stimulation with drugs. These tests are helpful, however, they predict the quantity rather than the quality. And many fertility doctors recommend that women above 38 that are infertile should aggressively do a fertility treatment and proceed to IVF quickly before fertility potential is lost. I would advise women to get married early if you have a man, so to say. And if you have a man, thinking about financial security should be the least of the problems because of age. We should always seek treatment early, so that if there is something that one can advise you to do, even with that age, you will be able to do it before it's too late. Thank you for listening.